Today I'm going to be demonstrating advanced wound care management. First, you want to check the scene for safety, apply PPE upon approaching the patient, ask for consent to treat, and identify the area of hemorrhage. To control the hemorrhage, you want to apply direct pressure using sterile gauze and elevate the extremity if necessary. Once direct pressure is effective and the hemorrhage is controlled, then you want to go ahead and examine and clean the wound. Here I am using some saline solution on sterile gauze to clean around the area and get any big pieces out of the wound. For smaller debridement or particles that are inside the wound, you can use tweezers to get that out as well. Once we've identified that the wound is longer than ½ inch and deeper than 1/4 of an inch, we can begin suturing. What we'll need is a sterile pad to catch any pathological waste and gloves for PPE. The tools I used were the surgical scissors, the Adson forceps, and the Heger needle holder. For the sutures, I am going to be using the nylon monofilament non-absorbable sutures. I am going to be performing the simple interrupted suture because it is the most commonly used technique and is preferred in urgent situations. And when it comes to removal, these are the easiest to remove. To start, you want to use an anesthetic to numb the area before repairing the laceration because it can be quite painful. If it is in your standing orders to give injection, you would give a lidocaine with epinephrine. Injection in small amounts subcutaneously around the laceration, and then epinephrine should only be used if there is no concern for vascular compromise. You would wait a few minutes until the area is numb, and then you would begin your sutures. You typically are supposed to start in the middle of the wound and work your way outwards. I just forgot to do that in my technique. However, I will be doing the pass technique with a pattern of 3 loops, 2 loops, and 3 loops to secure it. Once the wound is closed, you're going to use a sterile cotton tip applicator to apply the triple antibiotic ointment to the site. You're going to cover with a sterile non-adhesive pad, and you're going to wrap the wound accordingly. When it comes to post care, you want to make sure you keep the site clean and dry, especially for the first 24 hours. And then when it comes time to showering, you want to gently wet the area and pat the stitches dry immediately. You don't want to soak in the bath or swim. You don't want to pick at your stitches or scabs. And then you just want to be careful, no doing physical activities that might reopen the wounds. You want to make sure you follow the instructions on changing bandages and dressings just to make sure you keep the area clean and dry. Continuously check in with your ATC and team physician so we can make sure the healing process is going accordingly. And then the sutures will be removed within 10 to 14 days since it is on an extremity.